Well, hi, this is Jay Arthur, author of Lean Six Sigma for Hospitals and the QI Macros. And we're working our way through the Healthcare Data Guide. Now, on page 110, there's a series of data. So we have, in clinics, we have the average wait time versus average patient rating. And so we'd expect that if we have longer wait times, that they might not be that happy. So if we come into the QI Macros, click on our scatter plot, we can come down and choose scatter plot. And it'll prompt us for titles. But here you can see we have a downward trend, right? So there's an R-squared value of 0.66, so it's not really directly exactly related, but shows you this downward trend as we add more time. Now in Clinic 2, we could do the same thing. And here you can see we have more of a parabolic curve. All right, and in the QI macros, we're going to generate a linear curve, but we could actually change the trend line to be a polynomial or something like that. That might be a better fit. So it's going to tell us that that's very parabolic. So this tells us that initially it decreases, and then the longer you wait, eventually you get back to the point where you say, oh, what the heck? Right? And then clinic number 3, do a scatter plot. And here's a pretty linear relationship except one outlier point that's really low. And then in the last one, all the wait times are about 32 minutes. So this is going to look a little different. And so here you can see its satisfaction is irrelevant of wait time, except for this one outlier down here. So maybe other factors are at work in here. So that's how we can create all of those various scatter plots. Now, you can kind of see in here that we have various times in here, but the first groups here are actually the same. The wait times on the first 3 clinics are the same. So if I select those, I could choose the QI macros and choose matrix plot. And it'll give me a plot of all of those different ratings all on one sheet here. So we could have a look at that in a different way. All right, so here's our little parabolic ratings, and you can see that pretty clearly on here, and this might give you a way to drill down. That's how we can do scatter plots using the Healthcare Data Guide data and the QI macros.